All right, we're here today with Craig, and Craig is about to start his treatment with Dr. Davis. So, Craig, tell me about that knee pain. How long have you been experiencing it?
Probably 4 or 5 years or longer.
Was this due to an injury or an accident or anything, or just they started hurting and they just keep hurting more and more?
They just keep hurting more and more.
Okay. So, and I went over your discomfort level right now in those knees, and you're at a 10.
Yeah.
Are you usually always at a 10?
Not in the mornings, but time lunchtime gets there, and in the afternoons it's at a 10.
You're at a 10. So, is there anything that you do that makes it feel better?
Stay off of it.
So, resting.
Yeah.
Okay. Is there anything that you do that makes it worse?
Climbing a ladder, climbing steps.
Steps and a ladder. So that movement, you know you're going to pay the price.
Yeah. I pay for it the next day.
Yeah, absolutely. Okay. All right. So I'm going to have you do a couple things. And I really want you to focus on where you're feeling it in the knee when you do those movements.
Okay.
Okay. The first thing I'm going to have you do is just stand up for me. Okay. Where'd you feel that?
Knees.
Where at? Point to it.
Lower knees down.
Underneath that kneecap right there?
Yep.
Okay. All right. So I'm going to have you take a step forward. I'm going to have you put your knees or your heels shoulder length apart, arms out in front, keeping your heels on the ground. I'm going to have you squat down for me. Oh, I can see it in your face. Slowly come back up. Oh, where'd you feel that? I heard it.
Yeah.
I heard that. Where'd you feel it at?
That knee.
Okay, underneath the kneecap again? That spot? Okay, so that seems to be a number one spot so far. All right, up and down the stairs. And back up. Okay, all right. It looked like up the stairs was more difficult for you.
Yes, because all my gravity weight's going downstairs.
And where were you feeling it, Craig?
In my knees, it's bad in the bottom lower part of my knees.
Underneath that, below that kneecap?
Yep.
All right, let's get you started. Let's get you feeling better today. Are you ready?
I'm ready.
Deep breath and up. 1, 2, 3, 4. Let's do one more good one. Take a deep breath and go down and out. 1, 2, toes out. 3. Okay, good.
I got a thumbs up, Doc.
Good, good. We like thumbs up.
How's it feel, Craig?
A whole lot better. A little bit in that left one still.
What changes have you noticed?
Not the sharp pains no more.
Okay. All right, you feel taller? And the barb kick.
Hey, you did it good.
All right, we're back with Craig, and Craig has finished his treatment with Dr. Davis. So, Craig, let's see what you got. Can you stand up for me? Ta-da! All right, let's try that squat. Feet shoulder length apart. Whoa! Holy lowness.
Oh, that's good.
Nice smooth movement, it seemed like. Let's try those stairs. The stairs was your number one problem.
That's good.
One more time with the stairs, okay? You might have to do that a couple times before your body gets used to it again.
Just a little bit in that left knee. But not like it was.
All right, Craig, what changes have you noticed?
A lot. No more stabbing, burning pain no more.
Okay, but you still have a little bit in that left knee, which was your problem, child, to
Yeah,
begin
that was
with.
my problem, child.
Now, you started off at the 10. What do you think it is in that left knee now?
Maybe a 4.
Sweet! We haven't even done nutrition or therapies yet.
Right.
So, what would you tell other people who were thinking about coming in?
It's better than surgical.
Absolutely. And welcome to the family, Craig.
Thank you.